All right. Good evening. I'm SC. I'm the founder of Products That Count. It's awesome to see you again. How many people have been here before? Yeah, about a half of the room, just like every month. We love that. We have this program that we call Members That Count. If you come 5 times in the year, you get great perks for the following year. You get big discounts on all the events from the following year. You get invited to our holiday party. You get a really cool card. So, I want to start off by thanking our host, Yelp. They are amazing. Yes. They've been our host here in San Francisco from day one, and they're a team that's amazing to work with. People stay there a long time. They love working there. If you're interested in working for Yelp, I really, really encourage you to go talk to Rebecca, who's in the back over there, right below the red Yelp sign. I also want to thank our 2 other sponsors, Pragmatic Marketing. They offer awesome trainings for product folks. We've taken ourselves, like our volunteers and crew, some of those trainings. We love them. We think they're really, really high quality. I encourage you to check them out. And then I also want to thank our sponsor, WeChat. It's like, yes, WeChat, the Facebook of China, 800 million users. We're very lucky to have them as a sponsor. The other thing that I want to share with you today is a really big news. So aside from Products That Count, my main activity is to invest in early stage startups. And today, I closed my first VC fund. Yay! Thank you. We invest in teams and products that count. Haha, yes. I'm going to ask some of my investors to stand up. Yes, come on, guys. These are the finest human beings on earth. They want to support products that count. Yes, Gopal, Ruth, thank you. Awesome. Okay, so very excited to welcome Sami back. So Sami is barely human. Very human, but barely human. He's phenomenal. Founder of Trulia, world-class athlete, now founder of Virta Health, company that's going gangbusters. I was very lucky to meet Sami when he was building Trulia. He had a level of energy that was really phenomenal, and we've become friends since then. He gave a talk here at Products That Count a couple of years ago for, I believe, what was at our 1-year anniversary. The room at the time, Products That Count wasn't as big. The room was still that full. So he talked about his experience accomplishing the impossible. And I remember when he sent me his talk description, it was basically one line, like, how do you go about accomplishing or achieving the impossible? I said, Sami, I need a little description, like a 1 paragraph. He said, well, the paragraph is, how do you go about achieving what everybody thinks is impossible? Yeah, and that was a great talk. So it's available on our website. I recommend that you watch it. And then, Sami, welcome. It's great to have you.
Well, thank you very much for the overly kind introduction. And first, I have to say that if I melt during this presentation, it's because I grew up in Finland, and a room that's 90 degrees with no HVAC, for someone who really grew up in an igloo, effectively, is pretty hot. So it feels toasty here, but that's nice. So as Essi mentioned, so I was a co-founder and COO and president of Trulia, which is now a company that's about 2 blocks that way. And Trulia went public 2012 and then eventually merged with Zillow. And now I'm co-founder and CEO of Virta Health, which is a company also 2 blocks that way. In fact, it turns out Trulia and Virta are in the same building, but different floor. It makes recruiting much easier. So if you're starting your second company, consider that for for you personally as well. So this presentation is not so much about Virta, but I will mention briefly that Virta Health is an online specialty medical clinic that reverses type 2 diabetes. In fact, the very first company that can reverse type 2 diabetes and has clinical trial results to actually prove it, that it's real and it's doable. We're a reasonably new company, about 3 years old, and we just launched publicly about 6 months ago in March of this year. I'm curious, how many of you are in healthcare or wellness right now? So maybe like 20, 30, maybe half. And how many of you would like to go into healthcare, wellness type of field? So there's some. So that's good news because I'm hiring. So you can send me an email afterwards. Okay, so I titled this presentation, Curing Type 2 Diabetes with Tech, 5 Lessons Learned So Far. So why 5? It is 5 because most people remember 3 things. So there's error margin if you don't like some of my things. So pick your favorite 3 and remember those. So hopefully there's some takeaway. And whether you work in healthcare or not, hopefully there's some universal lessons that I've had over the last 3 years with Virta. So first one is find your North Star beyond the $3 trillion. And what's happening in this picture, which is actually taken by my wife, is that I am rowing from California to Hawaii, which was summer 2014. So this was a wonderful summer rowing trip that I did with my wife. So rowing unsupported, 2,700 miles from California to Hawaii, which took 45 days and 3 hours. And I had to take about 1 million oar strokes. And every single one of those 1 million oar strokes was physically ridiculously painful. I don't know how many of you row. I personally can be on an erg for maybe 15 minutes at the gym, and then after that, it's too painful and too boring. So I had to take about 1 million oar strokes over the course of those 45 days, 16, 18 hours a day. But what's interesting to me was, mentally, it was not painful at all. It was actually super fun, although I wouldn't do it again. But that's a different story. And the reason it was mentally very easy to take those painful 1 million oar strokes was that it was very purposeful. We wanted to do the trip to raise awareness about the dangers of sugar and show the world that you can exercise, 18 hours a day with no sports products, no coconut water. Somebody was offering it to me earlier, and no other stuff that athletes are usually asked to do. So purpose matters, at least to me, and makes hard things way, way, way easier. And in fact, that was part of the journey that led me to start Virta Health as well, because some of you may know that what happened to me personally was that I was also a world-class triathlete throughout those years that we were building Trulia. And I thought, well, sure, for someone who's lean and exercises 10 hours a week, there's no way I would need to deal with type 2 diabetes ever in my life. And then shockingly, I found out that I was pre-diabetic. And I thought, this doesn't make any sense. Like, how can that happen if you don't have any extra body fat that you're carrying and you're exercising and eating well? So long story short, then I discovered that type 2 diabetes is actually reversible. And before we even started the company, I defined with my small founding team that our purpose, our mission for Virta is to reverse type 2 diabetes in 100 million people by 2025. So that's sort of our North Star, to reverse type 2 diabetes in 100 million people by 2025. And it's been interesting to notice how that kind of a North Star and mission that's easy to communicate and easy to understand has been so powerful for me personally, and then also for the team throughout this 3-year journey. So one, it doesn't matter what you do, particularly when you go to a complex industry like healthcare, it's freaking hard. It's like, it is hard. So when you have a clear purpose that you care about, it's much easier to take those 1 million oar strokes or whatever it takes when you're building your company or working in a company. And second thing is recruiting, whether you're a CEO, founder, or head of product, or head of marketing, you have to build your team. Recruiting becomes much easier when you have a clear North Star that you can use and communicate to others. I recently hired our head of analytics from YouTube, and one of the questions I asked him, I said, well, like, why would you want to join us? And his comment was, are you freaking kidding me? Like, I've been spending the last 3 years, or number of years, trying to optimize that more people would click kitten videos. And just feels like it's not why I should wake up in the morning. If we can cure diabetes globally, this feels like maybe worth working 10 hours a day. So that's the second reason. And third one is, whether you run product or whatever you run, when the going gets very tough and busy and there's so many needs for your time, when you have that North Star that you can always share with your team, hey, this is why we're doing it. Yeah, it's very complex. There's so many things we could be doing, but what really matters? And obviously, at the CEO level and a team lead level, the North Star might be slightly different. But for us, it's reversing type 2 diabetes in 100 million people by 2025. So that's why I say find your North Star beyond the $3 trillion. And the reason I mentioned $3 trillion is that's about the amount of money we spend every year in the US for healthcare. So it's about 18% of GDP. It's a massive amount of money. But if you enter the industry that as your goal, I want to make a lot of money, or I'm just going to disrupt it, you're probably going to be disappointed. So that's sort of my one personal lesson so far, that when you have a very well-defined, very strong North Star that you can articulate, it will help you in so many ways. So second one, build a solution with the roles of healthcare red tape. So what I have here in a picture is two very handsome and beautiful individuals. It looks like a stock photo, but it's not. It's on the left, you can see Dr. Jeff Stanley, who's an internist. And then on the right, you can see Dr. Caroline Roberts, who's a Johns Hopkins trained endocrinologist. And they are both full-time doctors, my team members, Virta employees. So that might sound a little crazy. Why would you hire doctors? Why would you practice medicine? Why would you spend, by the way, it's complex to practice medicine in America. You need a different company in each state. You need doctors licensed in each state. You need a couple of $1 million, you need a year, and you need bunch of doctors to even be able to practice medicine in each state. Like, why would you do that? That's crazy. Why not just write software and sell it to doctors and have someone do the work for you? Especially with so much regulation around. And many startups say they run away from the regulation as opposed to run towards the regulation. So what we've actually done is we've turned the regulation to our advantage. So we decided to build what I call a full stack company, in that we have our own full-time doctors who practice medicine, obviously our own engineering team, our own data scientists, our own product designers in one company, in one package. And the benefit of that is manifold. One, if you want to apply AI, or let's just say machine learning, in healthcare, which we have to do to be able to do what we do, you need access to data. If you're a software company, good luck trying to get access to data from a healthcare provider or health system. Good luck. We are providers, so we own that data. We get massive amount of patient data on a minute-by-minute basis. We own that data as a provider. Secondly, we build software, but our doctors practice medicine, so we don't have to go and apply for FDA approval, because we're like any doctor. We just use software to give our doctors superpowers. The third thing that a lot of companies in healthcare struggle is like integration. Oh, we need to integrate with so many EMRs and so many systems before we can do anything. But in our case, we are completely standalone entities. So if you have a family member who's living with type 2 diabetes, they can go to our website right now and apply and become a patient. We don't need permission from anyone to do what we have to do. So we can effectively iterate and move at the speed of a mobile app gaming company while we are a healthcare company. And we give access to data that we can use to train our machine learning models by basically using that red tape and there's plenty of that in healthcare for our benefit. So that's the second one, build a solution with the roles of healthcare red tape. The third lesson is hire mostly Renaissance women or men. And what I have in this picture is math that even I can't understand. I think there's some sort of Bayesian probability thing going on. But the person in the picture is Jackie Lee, who's one of our data scientists. She has a PhD in natural language processing from MIT. An absolute superstar in her field. But what makes her even more powerful in our environment is not the fact that she has this super deep, amazing knowledge around natural language processing, which is valuable, but she can also make decisions like a product thinker or business thinker. Then she can build the tools, set up the tools, in fact, even build the tools, because she's also a software engineer. And then, of course, she can execute and make things happen. And so when I'm hiring people, particularly into a complex environment, I try to find individuals who have those three capabilities. By the way, in large companies, you usually have 3 people doing that job. So someone makes decisions, then they're like, oh, that's what we need to do. And then they call up 2 or 3 people, or hire 2 or 3 people to set up tools and systems. And they say, oh, now it's set up. And then they need another set of people to actually do the work. So in any environment, if you have this kind of Renaissance person who can make decisions, set up the tools, and then execute, it's not just twice faster, it's like 10 to 100 times faster. And particularly in our type of environment where you also have doctors and scientists and you have regulation, imagine if you have 3 people and each of them need to go and ask for advice and permission and ask if we can do this. You would just spend 2 weeks to even start something. But when you have a person who has the capabilities of 3 people in one brain, it happens in seconds, in minutes, in hours, in days. So that's my third lesson, which I think is applicable to any company, particularly going from 0 to 100 in any industry, but particularly in complex industries like healthcare, IT. I don't know how you would build a fast-moving startup without people like that. And I have many of my team members here from design team and product team, and I'm proud that practically every single one has this kind of a capability of those 3 things: decision-making, setting up tools or building the tools, and then executing in one person, regardless of the level. Fourth one, surround yourself with experts, then selectively ignore them. This is my favorite, and it makes a lot of people happy. So in this picture, I have a subset of our advisory board members and I guess no board members. So there's Bruce Bistrian, for example, is a professor at Harvard who wrote one of the very first papers at the end of late 70s, 1970s, to show, I think he had 7 people who reversed their type 2 diabetes. And he became a mentor to my chief science officer and chief medical officer who did his PhD at MIT as well. And then we have Senator Bob Kerrey, who knows government and working with government better than anyone I know. And then there's Dr. Radner, who was the chief medical officer for American Diabetes Association. So particularly for someone like me who came absolutely from outside of healthcare, 3 years ago, I knew nothing about healthcare, how to do anything in healthcare. It's been super valuable to have these amazing individuals around us and around me to advise and guide. And I think it would be completely naive if you go to a new industry and you're like, well, I'll just figure out, I'm going to disrupt this $3 trillion industry and I'll just go for it. And there's a lot of people I see, as an investor, by the way, who try to do that. You burn a lot of time and money with that approach. But if you follow the advice of all these experts who've been in the industry for 5, 10, 15, 20, 30 years, you're going to fail. Because they would have done what you think is going to completely change the industry if they knew exactly how to do it. Now, the very complex part of this listening and ignoring is not the listening. That's pretty easy. You just ask questions and they tell you all kinds of stories. The complex part is, how do you know what to ignore? How do you know? That's the tough part. And we did the same at Trulia. We had amazing real estate advisors, and then we just, thank you, that's awesome. We're not going to do it, but we're going to go that way. I don't actually know how to optimally filter what you should not follow and what not. But the one exercise that I use is I try to ask why. So when they tell you, like, you should not do that, like, I try to ask why and understand myself. And that's a way that I sometimes have been able to figure out, okay, that's what we should not do. And so one of the things that I heard from amazing advisors and very experienced healthcare experts was initially, it was pretty existential and fundamental, which was there's no freaking way you can reverse type 2 diabetes. You just cannot. You just can't do it. And people say, oh, like diabetes, it's the market cap around the pharmaceuticals alone is probably $1 trillion. Like if you say you can fix and cure that disease, it's going to change the whole world. Like this is going to change everything. Like it's impossible. If it was possible, someone would have done it. Like, that was the most fundamental thing I heard 3-4 years ago. And so I started asking myself, like, why is that? And in our case, the why nobody had done this before, there were kind of many layers. So one was just the biology and nutritional biochemistry, the science had advanced over the last 10 years to the point where it was actually possible to do this and sustainably and safely. And then the second thing was, just in the last 5 years, even the more elderly individuals started carrying smartphones and became comfortable interacting with physicians and someone who provides care remotely. And then the third layer was just this year, finally all American states allow telemedicine the way that it needs to be. So regulation had not caught up. And then the last thing for me that made me feel comfortable that I was right and many of the advisors were wrong was that actually to do what we do, you need a pretty unique founding team where you have hardcore scientists, clinicians, and then someone who understands technology. And you kind of have to get lucky that you have the right people accidentally collide. So surround yourself with experts when you go to a new industry, but then you have to ignore most of what they're telling you. Good luck trying to figure out what's right and what's wrong. Okay, last one. Make an early choice between outcomes and vanity. And this is specifically for healthcare. So what I have here is a screenshot of the very first peer-reviewed paper that we published early this year, which we then used to launch the company. And basically, we were able to show that you can reverse type 2 diabetes. You can get patients off the medications. You can save a ton of money, and it's real, and it's done in a real, solid clinical trial setting, so it's not just some claims. And we have more peer-reviewed papers coming out soon and very long-term results. But why do I make this statement? If you want to go into healthcare, in my opinion, you have to choose between two pretty orthogonal paths. Either you say, I don't care if this works, it's going to be free or near free, but I'm going to get to 50 million users somehow. Healthcare, wellness, whatever. If you have 50 million users, you can monetize it, AdSense, whatever. So that's one path. And there are some companies that have been successful with that. Actually, MyFitnessPal is one example. I was a proud angel investor in a company. Does it work? Does it make someone long-term healthier? Does it help someone? Who cares? But it's a utility that people like to use. So rather than tracking food on a paper, they track it in an app. You don't need outcomes. If you get 50 million people to download it, you can make it this. If you expect that somebody else is going to pay for the service, whether it's insurance company or employer, long-term, you need very, very solid outcomes, preferably from a real clinical trial. If you don't have those, you're just dreaming that you're going to get somewhere. And that's the path we chose at Virta. This is real. This is very real. We need to invest very heavily into real clinical trials that then allows us to become a covered service. And as I look at the companies who try to be in the middle, like, oh, we're going to charge $50 a month or $100 a month, and it's kind of this nice thing that makes you feel better or something, but we don't really have real data. It's like a death valley. There's a lot of companies that will go crash and boom and just can't scale. There's some exceptions, like most vitamins and probiotics. They are multi-billion-dollar businesses, but there's really no clinical evidence that they actually work. So that's my fifth. Make an early choice between outcomes and vanity, and don't be in the middle, because it's very likely that you're going to burn yourself out. Okay, Now you can do your pick and choose. So these are the 5 things I went through. Don't even try to memorize them because you can only remember 3. That's what I've been told. 3 things. So find your North Star beyond the $3 trillion. Build a solution with the roles of healthcare red tape rather than running away from regulation necessarily. Hire mostly Renaissance women. Surround yourself with experts, but then ignore them selectively. And then the last one is, in healthcare, I believe that you have to make an early choice between vanity and real outcomes. With that, I was told that I'm allowed to take questions, but I don't necessarily have to answer. Yes, please.
Do you have any, this is like completely off the topics you listed, but like since there was something on the posting how AI will disrupt healthcare, do you have any thoughts on that?
Yeah, maybe my presentation was completely off the topic. That's another choice because you said it's off the topic. So how AI will disrupt healthcare? What are my thoughts on that? Yes. How much time do I have? So I'm going to give you in 30 seconds. So what we do with AI, well, first of all, the high-level statement is we use software and AI, or I should say machine learning, not to generalize too much, to give our doctors and other care team members superpowers so that they are extremely productive. And I think that's definitely going to be the first application of AI across healthcare. That's what we do. There are definitely areas where you could completely replace human, and I think that's not what we do, but there may be some areas, maybe vision-related things and that sort of things. If you think of Tesla versus Google, what is the difference in terms of autonomous cars? Google's approach is, we're going to keep cranking until we have a car that drives itself and get to the level 4. And whether that takes $1 billion or $10 billion or 5, 10, 15, 20 years, it seems like they're going to keep going until they have it. A Tesla approach, on the other hand, was, well, there's a driver. We're going to start chipping away behind the scenes, give you more support for braking, for steering. You know, it's not perfect, but we're going to make the driving a more pleasant experience. We collect data, and we keep improving. But we are basically giving the driver superpowers. So my view and our approach is the latter one, more the Tesla approach, where we didn't want to wait for 10 years to say software is going to cure diabetes. We said people will do it, but in order to do it in 100 million people by 2025, and in order to even do what we do, you need tech, but then you can use AI and machine learning to do it much more efficiently. So that's my 1-minute answer to that question. Thank you.
So you guys are doing hard things because you have to deal with behavior change. So how do you think about leveraging software technology to help people with hard behavior change?
Yeah. I was asked to repeat the question. So the question was, how do we leverage technology to impact very difficult behavior change? Well, first of all, I'm going to make a statement that partially disagrees with what you said. So the reason we've been so successful is not because we focus on behavior change. The reason we've been so successful, and this is really one of the reasons I even decided to start the company, is we focus on fixing a biochemistry. To fix the type 2 diabetes and obesity epidemic, you have to fix the biochemistry, not focus on behavior change. It would probably require a lot more explanation what I mean, but if you fix the biochemistry in the human body, behavior change becomes easy. If you don't fix that, it doesn't matter what behavior change techniques you use, they're going to fail. And I personally was an example of that as a world-class triathlete, was using all the behavior change to try to eat healthy and exercise more. And after 20 years of that awesomeness and using all my willpower to do that, I still became pre-diabetic. So that's kind of not answering your question and arguing that the premise of your question is wrong. However, what we can do and what we do is, because of remote monitoring and ability to get biomarkers from our patients, it allows us to use technology to control and guide the patient on a near real-time basis. And so it completely changes the paradigm of working with the provider and doctor, which used to be either the 15-minute visit every 3 or 6 months, or you use telemedicine to call or contact the doctor when needed. So our care delivery model is continuous remote care. And that's only possible with technology. So there is definitely a technology element that's required to do what we do, but it is not applied to behavior change in the traditional sense. That makes sense. I think you are the next. What are the challenges for us to grow the service? The million hour strokes. I think a lot of that is execution. I would say for us, so we are now open in 46 states and we cover 98% of the American population. Perhaps the biggest accelerator for us will be once we have universal insurance coverage. In other words, our service already for most of our patients is free because either employer or insurance company covers it. And then we have patients who come directly and pay out of pocket. But in America, most people expect that somebody else pays your healthcare bills. So that's probably the biggest. If Virta was a fully covered intervention, which does make sense from an economic and health perspective, but it takes a pretty long time to have universal insurance coverage. I think that would be the biggest accelerator in this country. Let's do Amy.
So a follow-up to the previous question. Can you talk a little bit about your model versus, say, another company that's been successful with clinical data in this space, such as Omada? How does your approach vary, and are they complementary?
Yeah, so the question was, do you want to specifically talk about a company or just in general terms? How we differ? I wasn't quite sure. You said, how do you differ from other companies? And then you mentioned one company specifically.
Well, I'm curious about that one specifically,
Yeah.
because they do have clinical data.
Yes.
And they seem to be focusing on the same.
Yes. Yeah. Yeah, good question. So Amy was asking about other diabetes companies. So for us, well, first of all, I would say today there's companies in two categories at least. There's companies that are in a diabetes prevention world, and then there's companies that try to do something with actual type 2 diabetics. So we focus on people who are living with type 2 diabetes today. They may have had it for 15 years. They may be on insulin. And before Virta, the only way to reverse type 2 diabetes with clinical evidence to prove that was bariatric surgery, which is a $40,000, $50,000 operation, comes with a lot of risks, and it still doesn't work in most patients. Before us, nobody had been able to show that you can actually reverse type 2 diabetes without surgery and medications. So for us, it all comes back to outcomes. There is no other company, there's no other tech company, there's no other non-surgical intervention that today has clinical evidence that you can reverse type 2 diabetes, keep it in remission. So for us, it's all about outcomes. It's not about features. We don't sell features to our patients. We don't sell features to insurance companies. We don't sell features to employers. We say, if you want to reverse type 2 diabetes, here's the data. And by the way, you only pay for results, so there's really nothing to lose. So for us, it's all about the outcomes. And that's the differentiator, and that's the reason we exist. We didn't want to start Virta to have another diabetes feature or diabetes management company, a diabetes reversal company. Because if we don't reverse and cure these people, we're going to all be paying more than 100% taxes. Like, it's no joke. There's way more than 400 million people globally living with type 2 diabetes today. In China alone, there's more than 120 million people living with type 2 diabetes. And there is no cure. We are just pumping more drugs on them. And average person living with type 2 diabetes in America costs about $11,000 a year. And we spend almost $300 billion a year. It's like an industrial complex managing these patients. So if we can't cure and reverse, it's just like a ticking time bomb. So that's what we are focused on. It's all about outcomes, and that's our differentiator. Yes, please.
So you mentioned outcomes, and there is a pretty long-term and longitudinal aspect to understanding outcomes. Given that you guys are such a kind of early stage company, how did you establish the validity of those outcomes? And my second question is kind of a follow-up on that is, you're kind of making a claim of this being the reversing of the disease. What are the kind of costs and like maintenance associated with that reversal? Is there remission? Should they be on a drug for the rest of their lives? Like, how does that compare economically with the current setting?
Yeah, the question was how did we as an early stage company sort of establish that we can keep diabetes in remission for a longer term, and then what's the economic case for that? Well, first sort of baseline, and this is kind of goes deep into type 2 diabetes, so I don't know how many of you are interested in that, but let's go into it. So type 2 diabetes is commonly accepted that it's a chronic and progressive disease. What that means is once you have it for life. You can try to manage it, but gradually it gets worse. So what that means from a cost perspective is today the average cost across all diagnosed type 2 diabetics is about $10,000 to $11,000 per person extra. And then the costs keep ticking higher and higher. People become more insulin resistant. They need more drugs. That's the good care. And so it doesn't cure. We can just sort of delay the progression of the disease, and it means that your leg may not be amputated, or it's going to be amputated 5 years later. Or your heart attack that usually kills most people with type 2 diabetes comes a little bit later. That's the best-in-class treatment today. So if you can reverse the disease, and the definition to reverse type 2 diabetes is you get them off the costly medications, and you get the blood sugars and other metabolic health markers to a healthy, non-diabetic range, you can cut almost all of that cost, which on average is $10,000 to $11,000 per person living with type 2 diabetes. And our economic model is that we take fraction of the savings. So if we help a patient, we save money, and we get paid enough to pay our bills. So everybody wins. So the more patients we treat, the more money we save the society or the employer or the health plan, and the more successful the company becomes. So it's a nice virtuous cycle where nobody gets screwed. It's the sir in the green T-shirt.
Thank you. This is great. I like the approach. I especially like the thing about the red tape. The question that I have is a little bit about.
Yes.
And oftentimes with diabetes, there are things like eyesight loss.
Yes.
That happen. So there's some sort of distraction. So the question is, how do you manage that? Do you see a disruption in that as well?
The question was around recruiting patients, and then also how do we interface with the rest of the care ecosystem, right? Yeah, so, well, first of all, like I mentioned in the very beginning, that we are an online specialty medical clinic. And the specialty is a key word. We don't try to be a primary care doctor. Another example of a specialty could be orthopedics. So if you go to your primary care doctor, which I just went recently because my knee was hurting, and she said, okay, you should go and do MRI and meet this orthopedic surgeon and so forth. The primary care doctor is kind of the quarterback. So our role is to be the metabolic health or the type 2 diabetes specialist. And in fact, primary care doctors who send us patients, we become their best friend because they're like, nothing works with these people. They just come back, and all I can do is gradually keep dosing more and more drugs to try to bring the blood sugar to a what's called controlled diabetic, which delays the losing your eyesight and delays the amputations and other microvascular complications. So we fit into the ecosystem as a specialty medical clinic who knows how to reverse type 2 diabetes. And we make primary care physicians very happy, and we make the other physicians around the patient very happy. And we can, as a provider ourselves, we can operate independently, but of course we try to do our best to communicate with the other physicians around, whether that's the primary care doctor or somebody else that the person is working with. Did that answer most of your question?
I think so, yes. So it was perfect.
Not necessarily. So again, like I said, if you or your family member, anyone you know lives with type 2 diabetes, they can go to our website right now, apply, and they become our patient. The patient doesn't need, and we don't need permission from someone. But we want to be a good player in a healthcare ecosystem in that when you become our patient, one of the first things we ask is, who's your primary care doctor? Fax, email, this and that. And then we keep them very well updated, like what's happening, what we are doing, what medications we got them off of, and how the health has improved. And that's how you have to operate, because you want the quarterback, which hopefully usually is the primary care doctor, to have a 360-degree view of what's happening in your health. Let's do there on the back, sir.
What are the specific interventions that are changing the biochemistry? How many diabetics have you cured?
Oh, very good question. So the question was, what are the specific interventions that we use to manipulate or fix the biochemistry, and how many type 2 diabetics we've cured? The latter one is easy, because I'm going to say we will use it as part of our company communication at some point to share some of these key numbers, but at this point, we've decided not to share. However, what I can share is the clinical trial, which is public data, was almost 400 people, which is largest of that kind, particularly for a startup. It's a huge undertaking, expensive and complex. We had almost 400 people in our control arm, in our intervention arm that we recruited. Actually, I should mention, I forgot to mention this longitudinal thing. So our clinical trial was a 2-year study. It's now past 2 years already. And now we just extended it to 5 years. So we want to follow these patients very, very long term, because type 2 diabetes, every year that's in remission, you can save that up to, say, $10,000, $11,000 per person. So 5 times that is a lot of money. 1 time that is quite a lot of money, but 1 month is obviously not that big of a deal. So I did not really answer the number, but the intervention. So at the core of what we do is to switch your body from primarily using sugar and glucose as an energy source to a fat-based metabolism. And you can do that. It gets complex, but at a high level, the simple part is that if you restrict carbohydrates in a certain way, you can turn around your body's metabolism and produce most of the energy, not from sugar or glucose, but fat, whether that's dietary fat or your body fat. We can talk offline and go into the details, but at the simplistic level, that's the key mechanism we use with most patients. But everything is individualized, so there's nothing can be one size fit all when you take real patients, because everyone's metabolic health is very different, and people are on different drugs, so everything has to be individualized. Yeah?
Great, thank you. I want to ask a question about involving people in your company who have a personal stake or who experience type 2 diabetes or being pre-diabetic. So you mentioned yourself that you're pre-diabetic. My question is, have you been able to use Virta's therapies for yourself as a means of prevention? Was that a motivating factor, or are there, do you specifically seek out or serendipitously have within your team people who have type 2 diabetes who have since reversed it using the Virta approach? What effect has that had? How has that had an impact on the company and the mission?
Yeah, it's a good question. So the question was, have our employees and team members been on the Virta intervention? Have I myself been, and how has that affected the mission and the company culture? The easy answer is yes, 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 and yes. We have team members who have type 1 diabetes who have come and while that's not the patient segment that we focus on, who greatly benefited from what we do, we have team members who have had type 2 diabetes or pre-diabetes themselves. We have lots of team members who have family members living with type 2 diabetes. We have lots of team members who've lost their family members because of so. Especially for a company with such a strong mission and clearly defined North Star, and we were in effectively stealth mode until March of this year. Initially, the talent that started approaching us, there was a very personal reason, and in most cases still. Is that a prerequisite? No, to join a company, but it is. That's why personally I started the company. When you have that sort of a deep connection, whether it's directly you or your friend or your family member, it's a whole different level of excitement and motivation. And so I would encourage anyone, if you're starting a company around some topic, that you get a core group of people who have a connection that's bodily, personal, deep, goes way beyond an intellectual McKinsey analysis, like, is this opportunity big enough? Don't use the $3 trillion as a reason to start something in healthcare or any industry. It has to be something different. Please.
I just wanted to understand how you use machine learning just to provide
Yeah.
And secondly, do you also use exercise as part of
Yeah, so question was, how do we use machine learning specifically, what we do, and then do we use exercise as part of the protocol? How many things did we use exercise as part of the protocol? Raise your hand. Couple. And how many think we do not use exercise as part of our treatment protocol? Okay, so 90% are uncomfortable disclosing their bias. We do not use exercise as part of the treatment protocol. We do not. We have a lot of patients who, once they restore their metabolic health, they reverse their disease, they come to us and say, I think I'm ready to exercise first time in 30 years. What should I do? We help them. It's not required. We had, in fact, a quote from a patient yesterday or last week that said, I'm riding my bicycle for the first time, and this is someone in 50s or 60s. And my knees have finally enough space to move. But anyways, so no. So how do we use machine learning? In multiple areas. I'll just give you three kind of broad categories. One, majority of the communication is asynchronous. So if you use NLP and machine learning, you can figure out what's the need, and then you can either automatically respond back, or you can have suggested responses that then human brain, again, human assistant AI or ML, responds back. So we give sort of superpower. So that's one, automating or making the asynchronous communication more efficient. Two, most doctors today, they're looking for a needle from the haystacks. They're going through papers, files, folders, and imagine how inefficient that is. So we use machine learning to find the needle from the haystack and then surface it to the right person at the right time to say, hey, here's a clinical decision that you may need to make. So that's the second way. And then the third one is just, there's a lot of things that we can instantaneously give or offer to our patients as long as it's not tied into their clinical care. So if we see some data coming in, we can instantaneously tell the patient, hey, this is probably what's going on with you, or what you should do. So there's in multiple areas. But again, our approach is give the patient and our care team superpowers as opposed to, spend the next 10 years to try to automate everything 100%. In fact, it's not even legal because we practice medicine with doctors. We have one or two questions. So let's do David.
So thanks a lot. I have this intuition based on a little dangerous knowledge about diabetes, that the early stage of the disease, both biologically and kind of socially, is quite different than once someone has been a diabetic for a long time. And I'm thinking that economically there might be a bigger impact on the more complicated later patients, just reducing the cost of horrible complications that are super expensive. But I'm wondering whether the clinical impact and the skill required to improve a patient might be much less shortly after diagnosis, before the body's homeostatic mechanisms are sort of blown up by all that high blood sugar for so long. And I'm wondering whether you have any intuition about both the value clinically and also the value economically as a function of the duration of the diabetes.
Well, David was asking about the differences and potential complexities of A, treating clinically, and then B, the economic impact of a person at different parts of the diabetes spectrum. If one end is 20-year diabetic on insulin, perhaps liver is about to be, broken and you need dialysis, and then early if you're just recently diagnosed. Well, the economic is very easy to answer. It's a pretty steep curve. If you are pre-diabetic, for example, your cost to the health system is 0 extra today. Now, I don't know on top of my head how many years you need to sort of discount back to today to say that you actually cost something. I was pre-diabetic, world-class triathlete. I didn't cost the health system anything. I was a ticking time bomb, as an example. You're type 2 diabetic on insulin. We have a lot of patients who came in. In fact, we have one public testimony. There was the one gentleman who was spending $600 out of pocket a month on insulin. Now he's spending 0. That's thought to be impossible. This is anecdote. It's not trial results, but it's a one-person story. $0. So yes, is way more expensive in the tail end. We focus on the tail end. So in our clinical trial, you can go to the papers and look at, I think if I remember, the average duration since type 2, the average since type 2 diabetes diagnosis is sort of in the ballpark of 10 years. These are sick people, really sick people, unfortunately, and we've been able to help them. So then the second part of your question was, how does that sort of, can you help people who've been diabetic for 15 years, 10 years? Yes, we can. Biochemically, from a sort of behavior perspective, this is anecdotal. I don't have a comprehensive analysis in my brain about this, but I would say that for some, the longer you've been living with type 2 diabetes, the more massive the perceived and real benefits are. Most of you here in Northern California, everyone's going to CrossFit 3 times a day, so you don't really know what it is to live with type 2 diabetes for 20 years, but you're sticking a needle into your body 1 to 3 times a day. You're so tired that you can't even work. You don't have feeling in your legs, your toes. You're about to have an amputation. It's a reasonably miserable existence. And then you go and take that kind of a patient, and in 3 months, again, I'm getting anecdotal stories, so I'm not saying that this is the average, but in 2-3 months, they're completely off the insulin. They've lost so much weight that they start exercising. They may have gotten feeling back in their toes and their feet. They're walking on a beach and feeling the sand and the water first time in 15 years. And if you'll go through this kind of a thing, they think, how is this possible? Why didn't anyone tell this to me 20? They become angry. They're ready to go and shout from the rooftops that this is nuts. I was on my way to dying and here I am. Okay, anecdotal story, but you can go to our website, you'll see these are happening in volumes. So the answer is, we've started from the tail end, the most expensive, and it seems that we can help them. What happens in earlier, is that easier? It's probably easier, but there's little economic value to the payer, the employer, and in fact, even for the person. If you're pre-diabetic, do you notice when your pre-diabetes is reversed? Maybe, maybe not. So the perceived benefit is pretty, although, it's a personal thing, so you can do more for someone. Did we have time for one more, or was that?
Yes.
Okay, one more. We had so many men asking questions, so I'm gonna try to balance the gender here.
So how do you engage insurance companies to cover your burnout? It seems to me like, you don't quite have the path burnout or diabetes. Do you have health economics data showing that a significant level of compared to
So the question was, how do we convince economically that we can deliver savings? And do we have health economics data? We have health economics data from our trials and our commercial patients. We haven't publicly published a paper yet. We will in peer-reviewed journals to have for everyone to take a look at and see exactly what's happening. So how do you then convince a payer, whether it's an employer or health plan? There's one thing that's very black and white, clear, and easy way to prove the value. There's two components to that. One, we only get paid if we deliver results. So we don't say, oh, we're going to charge you X, and then good luck, let's see what happens. We say, we can charge you if we deliver results. And then two, diabetes costs, there's care, medication, so forth. There's a layer cake, although cake is a bad analogy here, but medications. You look at our clinical trial results that are already published. In under 10 weeks, more than 80% of the people starting on insulin were either completely off or substantially reduced. Whether you're an employer or health plan, you see pharmacy data constantly, at least on a monthly basis. So when you get someone off of insulin who's paying $600 out of pocket or whatever the total cost is, you see that very rapidly. So in under 2 months, the savings are very clear. So those are the two things we use. Pay for results only, and then two, our savings are very crystal clear, at least as it relates to medications. Then the utilization is more complex. Like if you end up in ER, those happen less frequently. So that takes a longer time to show.
Sami, thank you very much. All right, so now it's the time for shout-outs. So shout-outs is your 10-second to come here and make an announcement. If you're hiring, you're looking for a job, you're launching a company, you're seeking users, please line up here. And please do it now. Every time I have to push people to do it right now. And there you go. So.
Hi, everybody. My name is Ravi Singh. I'm a product manager with about 3 years experience in e-commerce, specifically working on the checkout flow. I'm looking for product management opportunities in health tech. So that's about 10 seconds.
Hi, I'm James from Virta Health. We are developing a device to measure vitamin D and iron levels from a single drop of blood. So you can quickly assess your levels in your blood and then actually manage your vitamin intake over time. We're actually based in Canada, so I'm just looking to network with people here and then eventually raise some more funds to continue our development.
You get one of those. Any more shout-outs? Yes, okay. Guys, if you have shout-outs, please come line up here.
My name's Samir Jain. I'm a product manager at Rally Health. We make a number of apps to help people develop healthy habits, find and price care, make sense of their health benefits. We're hiring in a bunch of departments, product, QA, engineering, DevOps. So if you're interested in any of that, come find me or go to our careers page.
Any more shout-outs? Okay, please shout us, line up here, don't come one at a time.
Hello, my name is Will Dahl, that's D-A-H-L, like Roald Dahl, the children's book author. The Clinician Society for Sleep, it has helped to create a combined patient and provider sleep group called the American Alliance for Healthy Sleep, AAHS. And we're just starting this year. If there's any sleep-oriented tech folk, if you would connect with me on LinkedIn, Will Dahl. I'd love to hear from you and your ideas about how you could help the sleep community across the board, help everyone to realize their full potential. Thank you.
There you go. All right, any final shout-out? Oh, come on, guys. Come on.
My apologies. Sorry. Hey, my name is Nikolai. I'm from a company called DigiSite. And we're developing apps that facilitate the consults between a generalist and specialists. So we're hiring now, lots of different jobs. So if you're interested in that, talk to me and I'll be here.
All right. Any more shout out? No? Okay. All right. So next month, I'm hosting the the VP product at Instagram, formerly VP product and growth at LinkedIn. And he's going to talk about how you grow at scale. I hope to see you there. We have these events, like I said, every month. There's another half hour for networking. There's one last thing I want to ask you before you leave. In your inbox, you have a very, very short survey. So we take our program super seriously. We treat them like they're products, and we measure the net promoter score of every one of them. So it would be really, really helpful if you gave us 1 minute of your time to provide us feedback. We share that feedback with Sami when he wants to give another talk. He can learn from your feedback. We take that feedback seriously also for the way we organize those events. All right. Thank you very much, and see you next month.